Um, I'm Jess Hickman. We're a practitioner assistant here at Integrative Wellness Group, and I'm here with Dr. Nicole Rivera. We are starting our 6-part series on different symptoms and factors in mystery illnesses we see in our practice and in general in society. So Dr. Nicole, I guess we can start by kind of discussing different symptoms that you see in our practice on a daily basis.
Yeah, so one of the biggest things that we do here at IWG is we really peel back the layers in order to figure out what's really the root cause to why you're feeling the way that you're feeling, because most of the time, we're calling them mystery illnesses primarily just because people are coming to us and they're disclosing that they have very specific symptoms. Maybe it's fatigue, maybe it's low sex drive, maybe it's just their appetite is off, their digestive system doesn't seem right, headaches, etc. And they're pretty much getting lab work done telling them that there's no problem, that nothing's coming up, you're generally healthy, and it might be in your head essentially. And we hear this over and over and over again. And we also live in a world that a lot of things are also blamed on hormones, for females especially. We get told that maybe it's a thyroid problem, or maybe it's just a hormonal fluctuation due to our age. And there really is a way bigger picture that's going on. And unfortunately, it's not common practice to be testing for some of the things that we are testing for to really get the clarity around these different symptoms.
Why do you think there's such a prevalence of these? It seems like everyone is just tired or sick or not feeling well. Why do you think this is happening so often?
Well, I think there's a lot of reasons. I think that this epidemic of just generalized low-grade symptoms, again, like you said, fatigue, maybe not sleeping the best, or just feeling off in general, it's partly because of how much our food industry has really changed. That plays a very big role. We're dealing with a food industry that is not nourishing us anymore. It's primarily making us sick. And we hear the terminology, chicken, antibiotic free and pasture raised. And I feel like a lot of people just don't know what that means. And, the biggest thing that I explain to my patients is if you're thinking about the concept of your chicken being antibiotic free, well, why was the chicken given antibiotics in the first place? Primarily because it was a sick chicken. And we also assume that the chicken is only maybe dealing with a bacterial issue, but there can be parasite issues. There can be a lot of different things that are going on that are playing a role. And we need to be really evaluating people for these things when we're looking at them through their labs and through different diagnostics. So, outside of just the food industry, we also live in lovely New Jersey here. But, we live in a world right now that there is toxicity everywhere. We have a lot of companies that are producing, new materials and plastics and all of these different things. And unfortunately, it's creating a huge burden for the earth. And we're having a lot of different contaminations in the water, in the oceans, etc. So we have that going on just from an environmental perspective. And I think one of the most interesting things that people are going to be the most surprised about is this issue with mold, but it's becoming more problematic because of all of the wireless technology that we have. And one of the parts of our series is we're really going to dive in and talk more about mold. But how many of us are hearing about our own children or other children that are dealing with like major issues in school? They're either, dealing with allergies, they're sniffling, they're coming home with runny noses, they're having ADD, they can't concentrate, etc. And part of it is mold has been an issue for many, many years. It's just not something commonly looked at. But it's becoming more problematic because in some of the studies that they've done, they've actually found that mold can multiply by 600% per week in the event that there is a constant influx of wireless technology. So the schools now, if you have kids in school, what are they getting? They're getting an iPad, they're getting a laptop, and that means there's those hotspots in every single one of the classrooms. So there is an issue just with the constant stimulation from these devices, in addition to the potential that it's causing an overgrowth of some of the molds in the schools that most of them are old. So it's been there, but it hasn't been as big of a problem until we have this major influx of technology.
It's magnified by all of these things that we now have in our today.
Exactly.
So how do these factors contribute to the stealth pathogens that we see here at IWG?
Well, just to kind of clarify stealth pathogens and what that actually means is, so right now, I think that some of us hear about antibiotics not working as well as they used to. And, we're getting sick and then we're going and maybe getting our Z-Pak, or we're getting, a round of antibiotics, but we're sometimes not better, or we get switched to a different antibiotic or a different approach. And the biggest thing to understand about that is we have this evolution of microbes that are happening. And when I say microbes, primarily what I mean is bacteria, viruses, all these different types of infections that we know that we get when we get the common cold or we get a flu. But these microbes are becoming more prevalent because of the contamination in our waters and our food supply, number one. But also number two is they're becoming able to actually evolve past our immune defenses. And that's really where that term stealth pathogens comes from, is they are literally evolving past the capacity that our immune system knows how to fight them. And this is happening partly because of the overuse of the antibiotics in our food. So if you're a person that says, oh, well, I don't really take antibiotics, I just ride it out when I get sick. Unfortunately, if you eat out or you travel a lot and get stuck eating at restaurants and airports, or you just don't buy anything organic or pasture raised, you're getting a dose of antibiotics pretty much every single day. And I think that's an important factor for people to understand, is because of that, and also because of all of the antimicrobial soaps that we use and all the harsh cleaners we use in our homes, we are actually developing superbugs.
Harming ourselves more than helping ourselves.
Yeah, and it's coming from all different angles. It's not that if we just change everything in our homes, we'll be in complete control. It's because a lot of these antibiotics and pharmaceuticals, they're also contaminating our water supply. So we think like, okay, well, drinking water, I need to drink water, it's safe. But unfortunately, there are many organisms that actually know how to survive past what we use to clean the water, which is chlorine and ammonia. So it's a bigger issue than people realize. And I feel like at this point in my practice, I've become essentially an infectious disease doctor, because I'm tying back this major immune system burden to all of these chronic symptoms that people are dealing with. And once you peel back those layers, it's amazing to see how most of those symptoms go away, but also, especially for women, most of their hormones completely balance out on their own, which is, I think, so amazing, because if you have major immune system burden, your immune system is going to take all of your energy stores, and there's not enough energy and reserves to really keep all of the hormones of the brain and also sex hormones balanced. So those pretty much go on the back burner and until the immune system burden is lifted.
Okay. So talking about kind of how these pathogens arise, like what are different types of transmission, things that we might not necessarily know about?
Well, we're going to scare everyone right now. So the interesting thing is, obviously we're talking about water contamination, we're talking about food, unpasteurized milk and dairy products can be part of the puzzle. But I think one of the most interesting things that there's a lot more research coming out about it, number one, but also it's something that we see on the regular in our practice, is that, you think about the concept of a young child. You think of an infant, a month, 2 months, that they're coming out of the womb and they're all of a sudden they're colic, they're spitting up, they're having, digestive issues, or they're not feeding properly. And it's like, well, this is a brand new, perfect baby. How is this happening? What's going on? Is it genetic? That's of course like what I feel like the medical system is driving home, is there's genetics playing a role in chronic illness. But the interesting factor is that there are many of these infections that are actually passed transplacentally, which means it's passed from mom to baby. And one of the most eye-opening things to me is a couple of years ago when I was testing a newborn, and one of the primary things that came up was mercury toxicity. This is a newborn baby. They don't have any fillings in their teeth. They don't eat fish. Like they haven't even lived long enough to have exposure from any other areas of contamination. So I asked mom, I said, Mom, do you have a lot of fillings? She's like, yeah, pretty much my whole mouth is silver fillings. I've had them since I was a kid. So there was actually a transmission of mercury from mom to baby. And it was also her firstborn. And the firstborn gets 80% of mom's heavy metals. So it's a very interesting factor because you can literally have a baby starting their life already immune compromised because of what is being passed from mom to baby. And this is very, very important to think about the concept of infertility. There is a huge problem right now with infertility. And it's very frustrating to me because I feel like a lot of women think, what's wrong with me? Why is this happening? There's something wrong with me. And they're not understanding that we have a lot of things working against us in our environment that can be causing us to have these different types of infections or toxicity. And this is a factor that if your body knows that you have these things going on and it could potentially be passed, then it's going to prevent you from getting pregnant until it's resolved. And it's a very common thing that I see. And once you defy nature and you go through that route of fertility treatment, you could potentially be setting your child up for having different mystery illnesses.
So Lyme is something that we see in our practice a lot. Can you talk about kind of the different types of transmission related to that?
Well, really just piggybacking off of what we're talking about, with the mercury example is a lot of times when we're dealing with Lyme in the practice, Lyme is a very, very interesting pathogen. It's a very interesting condition. But the longer that I do this, number one, I find that Lyme is never the one issue. There's usually an array of other viruses, parasites, different types of, or other types of bacterial infections. So there's usually an array of things going on, and it's primarily just because the immune system is so compromised. Because Lyme, that's one of the things it does, is it actually debilitates the immune system. So with that being said, when we think about the transmission of Lyme, we're told ticks. That's primarily the way that we're going to get exposed. And it has to be the tick bite with the rash and then the onset of your flu-like symptoms. So if you do have that traditional textbook onset, that is actually, based off of the research, that's your second infection, which is very, very mind-blowing to people. And especially when I speak to other physicians, they're very unaware of this. And the other thing to understand is that, number one, it can be passed transplacental. So it actually can be passed from mom to baby. And the other factor is that it can be passed sexually. So one of the most interesting things that I've seen in my practice, and I didn't understand it in the beginning, was the fact that any male that I worked with that had a prostate issue, they always came up for Lyme. If they knew it or they didn't, they always came up positive for Lyme in their lab testing. And I didn't understand, if there was a true correlation because I really couldn't find much research on it. And with some of the recent research coming out, they're discussing the fact that because it can be sexually transmitted and Lyme is such an evolved species that it actually will live and hang out in the prostate, and then it will move through the urethra when the male is sexually active, so it can move to its next life cycle, which is AKA infect the woman, which is insane to really think about that.
Isn't there also a correlation between breast cancer and Lyme as well?
Well, anytime you're dealing with any type of cancer, there's a lot of layers to it. There's definitely emotional layers, but there is major infectious load. And everyone's going to be a little bit different, but you can have Lyme. So just to clarify, Lyme can live in all different areas of the body. I know when we think about the traditional diagnosis, it's living in joints, it's living in knees or hips, and that's why we get joint pain associated with it. But it can definitely live in all different types of connective tissue. And connective tissue is tissue that connects your joints, it's tissue that anchors your organs, and also it's the tissue that surrounds your organs. So you can literally have the Lyme spirochetes is what they're called. They can live in all different types of tissue, including the brain. So there is a huge correlation dealing with cancerous tissue, as well as even Alzheimer's and dementia with these Lyme spirochetes. And this is not my opinion, this is research. Yeah, so it's a bigger problem than people realize. And there's a lot of people getting diagnosed with depression and bipolar and severe brain deficits that have a lot to do with infectious load of the brain.
So how does all of this contribute to our autoimmunity issues?
Well, if you think about the concept that infections like Lyme we're discussing can live in different parts of the body, it can live in organs, it can live in all different types of tissue. So your immune system is going to do its job, and it's going to try to fight these pathogens. It's going to try to fight off these infections. And if we say that there is an infection, let's use strep as an example. So when we get strep throat, we think specifically it just can reside in the throat. But the most common thing I find in people's thyroids is actually strep. So if you have strep in your thyroid, your immune system is going to do its job. It's going to go to that tissue and it's going to try to fight off the strep. But unfortunately, it's going to start damaging the tissue around it. So then when you look at blood work, you're going to find antibodies against the thyroid, which is classified as an autoimmune thyroid condition. So there is a huge connection with the immune system attacking certain microbes in specific tissue and the onset of all different types of autoimmune conditions. But the moral of the story is if you have an autoimmune condition, you have infections. And it's a matter of clarifying what those infections are and how you can fight those to stabilize the autoimmune response.
So why don't we hear so much about all of these different things in traditional medicine? Like, it just seems like we aren't testing for those types of issues, pathogens, and making these connections.
It really just has to do with training. Don't get me wrong, I've done training with so many different institutions and so many different physicians, because when you're in clinical practice, you get presented with bizarre cases. You get presented with things that are not always easy to figure out, and you just have to keep learning and evolving and peeling back those layers, because most of these people coming in with these mystery illnesses or these mystery symptoms, it's because of a snowball effect that's been happening over their lifetime, and they've been acquiring more and more either infections or toxicity from our environment, as well as contamination in food, etc. So you have to really have a broad scope. And when you think about the way that the system is set up, there is the cardiologist that's the heart specialist, and then there's the infectious disease doctor, and then there's the endocrinologist. And at the end of the day, all of those systems are connected, and you have to be able to have the bird's eye view and look at all the systems and understand it and understand how it all works together. And it's just not traditionally how the system is set up. So you work with the experts that are experts in all different systems or all different avenues. And at the end of the day, we need physicians to piece it all together, because it's not that simple anymore. Maybe it was in the past, but it's just not anymore.
Can you shed light on how the testing at IWG is different?
Yeah, definitely. We really explore so many different avenues of testing, because we bridge the gap between alternative medicine and medicine. Mm-hmm. And what I mean by that is we're doing the traditional lab testing. We're doing nasal swabs, stool samples, blood testing, urine analysis. We're doing a variety of different things with lab testing. Mm-hmm. But what's interesting is it was a couple of years ago that was very, very eye-opening to me. And we had a specific patient who came in, and we tested their blood, mm-hmm. and Epstein-Barr virus came up. And Epstein-Barr, technically, according to the blood, was a past infection. Mm-hmm. So I was kind of like, okay, well, this is not a primary player in the symptoms right now. Mm-hmm. It's just something that was maybe affected you when you were young, but it's not a problem at this time. Mm-hmm. So then we did other testing. We do something called autonomic response testing, which is actually created by Dr. Klinghardt, for those of you familiar with that name. Autonomic response testing is actually working through physics in order to bring another level of analysis and diagnosis. So we're bridging the gap between chemistry and physics. So through that testing, one of the remedies that this patient came up for was an Epstein-Barr virus homeopathic remedy. So I found that very interesting. I was like, well, technically, if this is a past infection, this wouldn't necessarily be a remedy that this person needs at this time.
Yeah.
So we took it a step further, and one of the primary therapies that this patient also responded to was something called Viaderm, which is a very, very superficial dermal therapy. It's actually used to push different homeopathic remedies into meridian points. So the meridian that was actually responding to this Epstein-Barr virus homeopathic remedy was the meridian connected to the entire central nervous system. So literally the brain and the spinal cord. So to sum that up, and what that really means is that the Epstein-Barr virus was showing up as a past infection in the blood because it wasn't in the blood anymore. It was actually living in this person's brain.
Wow.
This is also a patient who has a family history of multiple sclerosis. So one of the primary triggers for MS is Epstein-Barr virus that makes its way into the brain. So that was really pivotal for me, because I realized at that point that you can't rely just on one level of analysis. You have to look at the bigger picture, and you have to involve physics, and you have to involve traditional Chinese medicine, which is working through meridians and energy, and then you have to combine the chemistry. And that trifecta together gives you so much information about the patient and allows you to get them on the right track from day one. And it's not this guessing game, and we're not giving them cookie cutter protocols. We're literally customizing everything to what their body needs.
Thank you, Dr. Nicole, for giving us all of that information, scaring us a little bit. And next series is going to be Parasites, our next episode. So prepare for that one. So thank you for joining us, and we'll see you soon.
Bye.